Hello, everyone. This is a brief PowerPoint going in more in detail about Medicare and Medicaid origins of coverage, as well as the benefits that are covered under Medicaid and Medicare. This PowerPoint provides more background on Medicare and Medicaid, as well as the services and benefits that are covered under each program. Medicaid is a provision signed into law in 1965 by President Lyndon Johnson, and it provides health care coverage to millions of Americans, including eligible low-income adults, children, pregnant women, elderly adults, and people with disabilities. Medicaid is administered by all states, including D.C. and U.S. territories, according to federal requirements. The program is funded jointly by states and the federal government. Each state administers their Medicaid program differently, resulting in variations in Medicaid coverage across the country. The Medicaid program is funded jointly by states and the federal government. Each state administers their Medicaid program differently, resulting in variations in Medicaid coverage across the country. So, how the programs are administered can differ from state to state. That way, a recipient of Medicaid in one state may have different types of coverage and duration of coverage than someone that may have Medicaid in another state. States determine the type, amount, duration, and scope of services within the broad federal guidelines. Federal law requires states to provide certain mandatory benefits and allows states the choice of covering other optional benefits. And so there are a mandatory set of services that must be provided under federal law, but they may differ in terms of the type of optional benefits. States do have a right to pick what optional benefits they want to provide or not provide. In the other PowerPoint presentation, those optional benefits were discussed. Mandatory benefits that must be included based on government guidelines includes inpatient and outpatient hospital services, physician services, laboratory and x-ray services, um, and home health services, among other things. Optional benefits include services including prescription drugs, case management, physical therapy, and occupational therapy. Medicaid in DC. DC's Medicaid is a healthcare program that pays for medical services for qualified people. We talked about some of the qualifications for that in a prior PowerPoint. It helps pay for medical services for low income and disabled people. For those eligible for full Medicaid services, Medicaid pays healthcare providers. Providers include doctors, hospitals, and pharmacies who are enrolled with DC Medicaid. Eligibility, anyone who meets the Medicaid eligibility requirement can receive Medicaid, and Medicaid recipient can be any age, race, or sex. What services are available in DC? Well, DC's Medicaid services, for example, include doctor visits, hospitalizations, eye care, ambulatory surgical care, medically necessary transportation, dental services and related treatment. Dialysis services are covered, durable medical equipment, emergency ambulance services, hospice services, laboratory services, radiology, medical supplies, mental health services, physician services, nurse practitioner services, and home and community-based services, and transplant. A good exercise would be to consider other states that you may be living in or used to live in and compare how DC's Medicaid benefits and coverage compares to other states that you're familiar with. How to apply. You may apply for Medicaid or for low-income families and children under the age of 19 and pregnant women at your Income Maintenance Administration office or service center. The number is listed here for that area, for that number in DC. You may also apply for benefits at the IMA service centers as listed below. Now, Medicare benefits. What is Medicare exactly? It's a federal health program for, again, people who are age 65 and older, certain younger people with disabilities, and people with end-stage renal disease, permanent kidney failure requiring dialysis or transplant, sometimes called ESRD. What is Medicare coverage based on? Federal and state laws. National coverage decisions made by Medicare about whether something is covered. Similar to Medicare, it's federal guidelines. States um, also have um, uh, 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 options to provide additional coverage under Medicare. National coverage decisions made by Medicare about whether something is covered. Local coverage decisions are made by companies in each state that process claims for Medicare. These companies decide whether something is medically necessary and should be covered in their area. How does Medicare work? There are four parts of Medicare, as we reviewed in another PowerPoint presentation. There are two types of Medicare, what's considered the original Medicare and Medicare Advantage. Original Medicare, which includes Part A and B medical insurance, and if the client wants drug coverage, they can join a separate Medicare drug program called Part D. Medicare Advantage is also known as Part C, which is an all-in-one alternative to original Medicare. These bundler plans include Part A, Part B, and usually Part D. Part A in general, Part A covers inpatient care in a hospital, skilled nursing facility, nursing home care, which is inpatient care in a skilled nursing facility that's not custodial or long-term care. Part A also covers hospice care and home health care. Part B covers two types of services: medically necessary services and preventative services. Medically necessary services include services or supplies that are needed to diagnose or treat your medical condition and that meet accepted standards of medical practice. Preventative services, health care to prevent illness like the flu or detect it at an early stage when treatment is most likely to work best. You pay nothing for most preventative services if you get the services from a healthcare provider who accepts Medicare. Part B covers things like clinical research, ambulance services, durable medical equipment, mental health, inpatient, outpatient, partial hospitalization, and limited outpatient prescription drugs. What's not covered in Part A and Part B are long-term care, also known as custodial care, most dental care, eye exams related to prescribing glasses, dentures, cosmetic surgery, acupuncture, hearing aids and exams for fitting them, and routine foot care. If you need services Medicare doesn't cover, you'll have to pay for them out of pocket or yourself unless you have other insurance or a Medicare health plan that covers them. These are the supplemental plans that we talked about earlier. Part C, instead of original Medicare, you can decide to get your Medicare benefits from a Medicare Advantage plan, also called Part C or Medicare Private Health Plan. Remember, you still have Medicare if you enroll in a Medicare Advantage plan as well. Part D drug plan covers. Each plan that offers prescription drug coverage through Medicare Part D must give at least a standard level of coverage set by Medicare. Plans can vary the list of prescription drugs they cover, called a formulary, and how they place drugs into different tiers on their formulary list. So what is covered by the various parts of Medicare? Original Medicare,
Different parts of Medicare cover different services. You may hear about four parts of Medicare: Part A, Part B, Part C, and Part D. Part A, or hospital insurance, is part of original Medicare and covers most medically necessary hospital, skilled nursing facility, home health, and hospice care. Part B, or medical insurance, is also part of original Medicare and covers most medically necessary doctor services, preventive care, durable medical equipment, hospital outpatient services, laboratory tests, x-rays, mental health care, and some home health and ambulance services. Medicare Part C is not a separate Medicare benefit. Rather, Part C is the Medicare Advantage part of Medicare, allowing private health insurance companies to provide the same Medicare benefits as original Medicare. If you want, you can choose to get your Medicare coverage through Medicare Advantage plan instead of through Original Medicare. Medicare Part D, or outpatient prescription drug insurance, is the part of Medicare that provides outpatient prescription drug coverage. Part D is provided only through private insurance companies that have contracts with the government, and each plan covers a different list or formulary of drugs.
Other important things that you need to know about Medicare, excuse me. Original Medicare includes Medicare Part A, as was discussed in the video, hospital insurance, and Part B, medical insurance. If you want drug coverage, you can join a separate Medicare prescription drug plan, Part T. You can use any doctor or hospital that takes Medicare anywhere in the U.S. You can add supplemental coverage like insurance from a former employer or a Medicare supplement insurance such as Medigap to help pay for out-of-pocket costs like 20%, like your 20% co-insurance that might apply with your plan. We talked more about Medigap in another video. But the key here is even with Medicare, there are some costs that the consumer may have to pay out of pocket, and that is that Medigap area in which you can account for by purchasing a supplemental coverage for that. Note, if you don't get Medicare drug coverage or Medigap when you're first eligible, you may have to pay more to get this coverage later. This can mean you'll have a lifetime premium penalty for your Medicare drug coverage. So usually you're provided an opportunity at the start when you're first eligible to get that type of Medicare drug coverage or that Medigap coverage. You will be provided with an opportunity to do it later, but it may cost a beneficiary more to get that additional supplemental coverage later on than it would be at the start of their Medicare benefits. Medicare Advantage, also known as Part C, is an all-in-one alternative to Original Medicare. These bundle plans include Part A, Part B, and usually Part D. They also may offer extra benefits Original Medicare doesn't cover. Plans may have lower out-of-pocket costs than the Original Medicare, and in many cases, you'll need to use doctors who are in the plan's network. Most plans offer extra benefits that Original Medicare doesn't cover, like vision, hearing, dental, and more. Resources for healthcare related questions. Here you can look at the CDC.gov, the Department of Health and Human Services.gov, HHS.gov, Medicare.gov, and Whitehouse.gov. We also have additional websites on Blackboard for you to refer. And here are the references for the information on this PowerPoint presentation. I just like to take the time to thank my GA. Nia Gibbs Francis for helping put this PowerPoint slide together. And I hope this helps enhance your knowledge of Medicare and Medicaid. If you haven't looked at the prior video uploaded on Blackboard about Medicaid and Medicare, please do that. Thank you.